Alright, so let's keep spermicide simple. Spermicide is a birth control method that is placed inside the vagina before the intercourse. Most spermicides uses a chemical called nonoxynol 9. So for exams, you don't need to turn this into a chemistry class. Just remember what it does, and it blocks the cervix area and it slows down or kills sperms, so sperm are less likely to reach the egg. Now, think of it like protection at the entrance. The spermicides will sit near the cervix. It will create a barrier effect and will damage the sperm movement. So if the sperm cannot move well, it cannot travel through the cervix into the uterus and all of the way up to the egg. Now, the big nursing point is that spermicide works best when it's used correctly every single time. So it is user dependent. That means that teaching to the patient will be important for this. So if you put it in too late, if the wrong form is used incorrectly, or if the patient forgets how to reapply it, then the protection will drop, right? So the clean memory line is this: spermicide is a sperm stopper, so it helps prevent pregnancy by stopping sperm from reaching the egg. Okay. Now, let's talk about forms and timing, because this is where nursing school questions like to play games. So, spermicides come in different forms. You may see gels, creams, foams, films, suppositories, tablets, and contraceptive sponges. So, some forms, especially gels, creams, they may work right away depending on the product, but other forms may need to melt or spread, especially films, suppositories, and even tablets. So a safe testing way to think about those is give them about 15 minutes before intercourse. Another major timing point is that spermicides usually works for about 1 hour. So if intercourse happens more than 1 hour after insertion, then the patient may need to apply another dose of the spermicide. And here's the big one: spermicide must be reapplied on every sex act, not every day, not once for the whole night, every sex act. Make sense? So for exams, remember this pattern. Some forms need 15 minutes and it lasts about 1 hour, and you have to reapply every time. Okay? Now, spermicides can be used alone, but it's usually better when it's combined with a barrier method. So think of like a condom, diaphragm, or even a cervical cap. The barrier physical blocks sperm, and the spermicide also will be adding a chemical protection by slowing or killing the sperm. So the two together give better pregnancy preventions, right? Than just using a spermicide alone. But do not let the word protection confuse you, okay? Spermicide does not protect against STIs. It's not an STI shield. It is STI protection is needed. That's what you need to remember. STI protection is needed. The patient needs condoms. So this is especially important because frequent use of nonoxynol 9 can irritate vagina or rectal tissue. Now, irritated tissue can create tiny openings and can increase the risk of HIV transmission. So if exposure occurs, then we have a high risk, right? So if the patient is a high risk of HIV or STIs, spermicide is not the method you want to use. Okay? Now, the board style answer is simple. Spermicide can help prevent pregnancy, but condoms are needed for STI protection. Make sense? Now, let's look at it really quick with a few hints. Spermicide usually contains nonoxynol 9. It is used before intercourse, placed in the vagina near the cervix, and the goal is to stop sperm before it reaches the egg. Some forms work right away, while others may need like 15 minutes, especially the hard ones and solid ones. It is usually effective for about 1 hour, and it must be reapplied with each sex act. It works best with a barrier method like condom, diaphragm, or cervical cap. And do not forget the safety teaching. Spermicide does not protect against STIs. Okay? So frequent use can irritate tissue and the irritation may increase the risk for HIV if the person is exposed. All right, so if the question asks you about pregnancy prevention, spermicide can be part of the answer. Okay, just remember, usually it's better to add a condom. Make sense? Now, thanks for watching Nursing Mode, and subscribe before the NCLEX asks you which contraceptive kills sperm. So just subscribe. Thank you. Have a good one.